Right, hello everybody. This particular lesson is going to focus on the bones of the leg. What you can see on this first slide here is the same chart that you've seen before. So these are muscle terms. There you go, muscle terms that might be helpful for you guys in learning these muscle names. So this is more in reference to the muscles that are going to attach to these bones. Off to the left, we see a few surface markings on bones. So, words that are going to show up again and again that describe something in particular about the bone. And so something that we're going to see today are trochanters. So these are large, rough projections. Essentially, these are for the attachment of muscles. And so as we talked about in a previous lesson, the more a muscle contracts, the more it's going to be pulling on the periosteum, where that muscle is attached to, and then that bone is going to grow stronger and stronger and thicker right at that attachment site. So actually a lot of the different bumps that we see are where muscles are going to originate or insert. And so on the femur, actually, we're going to talk about today, we have trochanters, so large, rough projections. And so the trochanters are similar but different to other terms such as the tubercles, right? So these are small, round projections, which is similar and different still to tuberosities, right? So these are terms that you will see in several different types of structures starting today and then moving into looking at the head and the arm. And so maybe this might be a flashcard thing that you might want to study. The head is a smooth articular surface usually on the proximal side of the body, right? And so right next to our head is our neck, and so a skinny portion next to the head is the neck as well. Another term that you're going to see again and again is condyle. This is a smooth, rounded articular process. And so when I say articular process, I mean a part of the bone that sticks out a little bit. It's nice and smooth so that there's less friction within a joint. Right? So we're going to see lots and lots of condyles. A crest is a prominent ridge. A fossa is a depression as opposed to a foramen or a foramen, which is a hole. And finally, a spine, right? So this is pretty much a pointy part of a bone. Okay, so let us start off by talking about the hip bones. Okay, what we see up at the top is a right hip bone. So both of these are right. We don't say hip bone per se. The correct term is actually an os coxa. So that will be one single hip bone. And so again, both of these are right. We can see the lateral side over here, and we can see the medial over here. Okay. At the bottom, I'm showing you a picture, an image of left ossicoxy or left hip bones. Okay, so let's just start walking through these here. You can kind of follow along on your list of terms. Each os coxa, so each hip bone, of which in the pelvis there are actually two, each hip bone is actually three independent bones fused together. Okay, and they kind of they split the bone kind of like this. And so the superior part of the os coxa is called the ilium, the ilium. And I spell that out because I see this word, I see this word spelled wrong all the time. There's only a single L. Also, it is ili for the bone, ile for the part of your intestine, right? So this is where spelling really becomes a big deal. Let's see, the ischium, right? And definitely follow along on your lab terms handout because my fingers can only write so small on this screen. And so this is the ischium. Essentially, this is what you are sitting on, if you are in fact sitting right now. And all the way to the anterior side, we have the pubis. Okay, and so ultimately, all three of these bones fuse together during the course of your own personal development, and of course they fuse together over the course of evolution as well. Let's talk about some of the specific structures within each of these different bones. First of all, if you put your hands on your hips, you feel this ridge up here, right? And so this is called the iliac crest. Right, remember a crest is kind of like a ridge, right? So that ridge that you feel in your hip bones, that happens to be the iliac crest. A spine is a pointy part, and so here, right, all the way on the anterior and superior portion of your os coxa, you have this pointy little projection, right? And so you can actually oftentimes feel this through your skin as well. So the hip points, if you've ever taken yoga, these are called your anterior, superior, iliac spines, right? So it's on the front, it's on the top, it is on the ilium, and it's a pointy part. So even though this is a super long term, this tells you exactly where it is and what it looks like. Okay, and so usually this is abbreviated anterior superior iliac spine, ASIS. On a practical, of course, please spell this out for me. And of course, to see all the spelling and everything, take a look at your handout. Okay, next, on the medial side of the bone, we have a little smooth depression right here. And this smooth depression happens to be where you have a couple muscles that are actually hip flexors. You'll get into that in the rest of the lecture, of course. But this here is the iliac, right? So same as the crest, fossa. Okay, so an indentation on the iliac bone. Okay. All right, next to this, we have what looks like a really rough patch right here, and essentially this is an articular surface as well. If we take a look down at the articulated pelvis on the bottom of the screen, we can see that the sacrum articulates or forms a joint with the pelvic girdle, so this ring of bony tissue around the pelvis or making up the pelvis, and the only place where the axial skeleton is going to articulate with the legs, right? So with the pelvis here, happens to be in this little line right here. It's usually called the SI joint or the sacroiliac joint. On the os coxa, we can also see this rough patch right here, which is where the sacrum and iliac or an ilium join together. So I'm just going to abbreviate this, the SI joint. Okay. As always, spell it out, but given the space restrictions, I'm just going to abbreviate here. Okay. Finally, the ilium on the posterior side has this really big V-shaped structure. Okay. This happens to be where your sciatic nerve exits from your lumbosacral plexus. Specifically the sacral portion, and it actually travels all the way down the posterior side of your leg. And so, you know, sitting down a lot or like sitting on things, or, you know, inflammation or other types of agitation of the muscles in your gluteal area can actually agitate your sciatic nerve, because it actually gets wedged kind of right here within this little notch here. Okay, and so that's besides the point. You will hear a little bit about that in the other portion of this lecture. But for now, this V-shaped structure is called the greater sciatic notch, right? It's greater, it's really big. Sciatic, spelled sciatic, notch. Okay. And so again, we are looking at the right hip bone, the right os coxa from two different perspectives. You can see this on the posterior side of the medial to the right and the lateral to the left. Okay. If there are any questions, by all means, just throw them out there and I will clarify accordingly. Okay. Next, let's talk about the ischium. If you kind of follow the greater sciatic notch, you'll see that it kind of extends a little bit farther into this little pointy region right here. Any point on a bone can be called a spine, and so this spine isn't on the ilium, it is on the ischium, and so we'll call this the ischial spine. Ischial spine. Okay. Another feature of the ischium bone is this rough patch right here, right? A big rough projection. We're all very much aware of this structure because frankly, you're sitting on it right now. So if anyone has ever said, oh, you have a bony butt, oh, I can, this is, you can feel your sits bones, right? In yoga, your sits bones are these rough projections, large rough projections. And so, just like we talked about before, this rough projection is called an ischial tuberosity. Okay. And again, those are your sits bones. That is what is bearing the weight of your body when you are in a seated position. Okay. Finally, the pubis. Okay. If we look down at the articulated pelvis at the bottom, we see that there is a nice fibrocartilage disc that joins the two pubic bones together on the anterior side. We can see this flattened portion right here. And that flattened portion is where the pubic symphysis is located. So that fibrocartilage disc. And so we call this flattened portion here the pubic symphysis. Okay, pubic symphysis. All right, last feature of the pubic bone is this big hole right here. In general, when we see holes on a bone, this is where nerves and or blood vessels are passing through the bone, right? So generally your blood vessels are pretty darn deep, and in order to get to the superficial side of your body, right, so actually out to your legs from your lumbar plexus, nerves have to pass through holes. And so this hole is called the obturator foramen, right? Foramen because it's a hole, and obturator, it is named after the obturator nerve. Okay. All right. There is one more structure on this image that I want to show you, and that is this big depression right here. Okay, note that this is only seen on the lateral side of the bone. This happens to be where your femur articulates. Right, so if we look at this articulated skeleton or pelvis down here, we can see that this big deep depression is going to point laterally. Right? This depression is called the acetabulum. All right, so that is the acetabulum. It is what articulates with the head of the femur. Okay. All of the diagrams that I have for you are all right bones. So I've tried to give you photographs of left bones. So let me just walk you through really quickly the structures on the left bones down below. Note the orientation is exactly a mirror image. So we can see here, this is the lateral side and this is the medial side of this left os coxa bone. Okay, we can see the acetabulum. Okay. Hi, what's up? Is it okay if I just run the signal? Yeah, it should be okay. I'm just running water. Okay, thanks. So here is the acetabulum. On the lateral side of the bone, note that the pubis points anteriorly, right? So it's going to point to the left on a left os coxa. It is going to point to the right on a right os coxa. Okay, we can see the obturator foramen. We can see the ischial tuberosity, ischial spine leading into greater sciatic notch. We can see the iliac crest. We can see the anterior superior iliac spine, the iliac fossa, sacroiliac joint. Okay, and the pubic symphysis, and I believe that is all. Okay, let me switch over real fast to the actual images. Okay, so these are coxal bones here for you. They happen to be right, or this one is a right coxal bone, this one is a left coxal bone. Maybe you should take a look at Mastering A&P so that you can actually manipulate these bones in real life, or in 3 dimensions, that is. Right, so this, we can see the very deep acetabulum, obturator foramen. Okay, this nice rough patch here on the bottom is the ischial tuberosity, pointy ischial spine. Okay, the pubic symphysis, which happens to be where these 2 bones articulate together in the front. And we can see back here, right, this super rough patch on both of these bones, this is where the sacrum is going to articulate as well. And so maybe in this configuration, you can start to appreciate this nice smooth iliac fossa in here. This is where, you know, it is actually in your pelvis, so your internal organs are sitting right here in this nice smooth area. You wouldn't want a really rough bone to be interacting with your internal organs like that. Okay. Also, I want to point out while we're here, this is of course an articulated pelvis. So this is a pelvic girdle, so essentially a ring of bony tissue wrapping around the axial skeleton. Here's the sacrum, and down here is the coccyx. Okay, this happens to be a male pelvis. The way that I can tell that this is a male pelvis are actually 2 ways. First of all, if we find this pubic symphysis right here, so this joint of fibrocartilage between the pubic bone and the pubic bone, we can see that the ischium actually forms an angle when the pelvis is articulated. So this angle right here. Okay. In a male, this angle happens to be acute, so less than 90 degrees, and we can see that it is less than 90 degrees here. Okay. On the other hand, a female pelvis, okay, we can see again this angle right here. It is called the pubic arch. This is generally greater than 90 degrees. So this is generally an obtuse angle as opposed to an acute angle in males. And the other thing that is different, besides just the width of the hips, is the angle of the sacrum. Okay, and so let me show you the males first. So what we can see if we look at the pelvis on the side is that the sacrum is essentially angled anteriorly with the coccyx pointed pretty much towards the front. Okay, so this is male as opposed to female. Right, we can see that the sacrum has a completely different angle. Right, so it's pretty much pointed straight down. Right, this coccyx is not pointed towards the front or the anterior side of the pelvis. And so both of these characteristics, right, the angle of the pubic arch, right, which is one of your lab terms, as well as the angle of the sacrum and coccyx, can help us to determine if a skeleton is male or female. And so of course that is important if you are an archaeologist or if you are CSI, right, in order to indicate male versus female. Okay, and again, if there are any questions, by all means, shout them out. All right, going back to, here we go. All right, so moving down the leg, one bone is going to articulate with both of the os coxae. That bone happens to be the femur. The femur is the longest, strongest bone of your body. It is your thigh bone, right, in the femoral region. Once again, the diagrams, the drawings are right femur bones. Oh, yeah, right femur. Okay, and the pictures I've given you are the left femur. This one is the anterior side. This is the posterior side. This is the posterior of a left femur, and this is the anterior. Okay, so we'll start proximally and work our way distally. The head, or the femoral head, is this nice smooth rounded portion right here. you can almost see how it might fit into the acetabulum like a ball and socket. And in fact, this is a ball and socket joint. It gives you the most mobility out of any type of synovial joint. Okay, the neck, right, is always right next to the head. So this skinnier part here is the neck. Okay. All right, now we can see that the epiphysis kind of gets fat again. We can see that there are a lot of these, or there are two of these kind of rough projections. The rough projections are called trochanters, right? On the lateral side, we have a really big rough projection. Okay, so the lateral side of both. This is called the greater trochanter. Okay. Again, it's on the lateral side. This is where muscles attach to essentially pull your leg out to the side or to abduct your leg. Okay. If there's a greater, there is probably going to be a lesser. Might be hard to believe, but generally we don't use too many terms in anatomy that we don't need. And so if you hear of a greater, there's probably a lesser. If you hear of an anterior, there's probably a posterior, and so on and so forth. And so the lesser trochanter is here. So it's a little bit posterior, and it's pointed medially, right? So towards the inseam of your pants versus laterally towards the outside of your body. Right? So this, again, is the lesser trochanter. Okay. If we look on the posterior side of the bone, what we can see is that the greater and lesser trochanters form almost a triangle, right? And if we were able to play with the bones in real life, you could actually feel that this is kind of a rough patch on the back of the bone, right? And so in this image right here as well, only on the posterior side, we see a rough triangular patch between the greater and lesser trochanters. This is called the gluteal, interesting, tuberosity. Okay, so a gluteal tuberosity, a smaller rough patch. And as the name suggests, this happens to be where, or at least one of the places where your gluteus maximus muscle is going to insert. Okay. If you, excuse me, if you follow that point of the triangle of the gluteal tuberosity all the way down, you see that there's this ridge on the back of the bone. And this ridge happens to be another site of muscle attachment. This is called the linea, right, as a line, aspera. Okay, and so this is where some of your adductor muscles are going to attach. Okay, next, let's move down to the distal epiphysis. All right, all sorts of different things going on here. First of all, we see that there is this little triangle on the anterior side of the bone. This happens to be where your patella is going to glide, right? So every time you bend your knee, bend your leg, essentially the patella is going to stay more or less with the femur as opposed to with your tibia. And so this is called the patellar surface. Okay. What we can see next is that the epiphysis widens out to two kind of bumps, right? So these are smooth articular surfaces. As we talked about on the first slide of this section, a smooth articular surface is called a condyle. Condyle. Okay, there are two of them, and so the medial one is called the medial condyle, the lateral one is called the lateral condyle. Okay, so first of all, note that the head always points medially, right? It has to point in towards your body to actually articulate with the pelvis. And so once we find the head, we know what side is the medial side of the bone, right? And so this here is the medial condyle. Okay, same thing on the left bone, right? So this and this, on the medial side, the same side as the head, that is the medial condyle. Okay, on the other hand, we have the lateral condyle. All right, again, a smooth articular surface on the lateral side of the bone. Okay. See, one more pair of structures on these bones before I teach you about left versus right. As I said, bumps are generally a source of muscle, a site of muscle attachment. On the femur, we can see a little bump pretty much sitting right on top of that medial condyle, and a little bump sitting on top of the lateral condyle. Okay, so the same thing over here, these little bumps on top of the condyles. These are lateral and medial, right, depending on which side we're talking about, and we call them epicondyles, right? Remember that the root epi means on top of, so this is literally on top of the medial condyle or on top of the lateral condyle, right? So this would be a lateral condyle, and this would be a medial condyle, okay? Let me switch over to the camera. Oh, interesting, I don't know how that happens sometimes. All right, switch over to the camera again. What we can see here are two femurs, okay? This is a right femur. Note that the head is pointed in towards the hip bone, right? So this would articulate in this fashion, right? So always pointed medially. All right, so this is the proximal, and this is the distal epiphysis. All right, so again, the trochanters on the greater trochanters on the lateral side, the lesser trochanters on the medial side. Right? If we flip this bone around, right, we can see things on the back that we can't really see on the front. Okay, first of all, this really rough patch, let's see, sorry, it'll focus here soon. Okay, so this really rough projection between the greater trochanter and lesser trochanter is the gluteal tuberosity, right? And hopefully you can see that there's a ridge that goes all the way down the posterior side of the femur, right? So that's the linea aspera. All right, so how do we tell left versus right femur? A couple different ways. First of all, if you can see the linea aspera, you know that that is the back. Also, with the femur and the humerus actually, there is a really big indentation between the lateral and medial condyles, right? So here we can see this nice smooth surface right here. Right? So this is a condyle. We know it's the medial condyle because here is the head. Right, so the medial condyle and the lateral condyle because it's on the other side. And there's a really big groove. This is called the popliteal fossa. It's not one of your terms, but if you see this super deep groove right here, this and the linea aspera means that this is the posterior side of the bone. Okay, so if we flip this bone around, now we know we're looking at the front. So the only other thing that we need to take a look at is the direction of the head. And so the head is pointing medially. Okay, so this is a left femur, and this is a right femur. Okay. We are going to move down the leg at this point. Right? So the very next thing that you're going to see on the PowerPoint is how the femur articulates with the next bone in line called the tibia. So this is now your shin. Okay. I want to point out that the medial and lateral condyles of the femur are going to articulate with the medial and lateral condyles of the tibia. Okay, and so what we can see here is that when the knee bends, right, essentially those smooth articular surfaces, those condyles are going to glide over one another. Okay. The other thing that we can see, right, before we move along here, is that the tibia is the really big, strong bone of the shin. Right, it's the weight-bearing bone of the shin, but there is a second bone of the shin, and that is the fibula. All right, so the fibula is a bigger word, smaller bone. The tibia is a bigger bone, smaller bird, right? Again, a little bit of opposites going on here. Also, the tibia has a big capital T at the top, epiphysis, and then the diaphysis essentially forms the other part of the T, right? So tibia for T, fibula, the really skinny bone, that is not a weight-bearing bone. All right. going back to our PowerPoint here. Okay, so like I was just showing you with the actual bones, the knee actually includes the medial, or sorry, this is the lateral condyle of the femur articulating with the lateral condyle of the tibia. Okay, if we look over on the tibia, we can see, again, these are a right shin in the diagram. So this here would be the lateral condyle, and therefore this would also be the lateral condyle. Okay, the medial condyle is on the same side as this hip joint, right? So the head articulating with the acetabulum. Here is the medial condyle of the femur sitting in the medial condyle of the tibia, right? Same thing, medial condyle and medial condyle. Okay, so if we weren't actually looking at the leg itself, right, so actually articulated here, how can we tell lateral or right versus left, lateral versus medial, right? It's all just one big T, right? And so the way that we can tell lateral versus medial is all the way down here at the distal epiphysis, we see that it's not symmetrical. Right? We see that the tibia has this little projection. Okay, this is called the medial malleolus. Okay, and so early anatomists thought that this looked like a mallet, right? So a little rubber mallet. And so they call this the medial malleolus. And actually we all have an awareness of this. This is your inner ankle bone, right? So on the medial side of your ankle, you can feel that little bone projecting. That's the medial malleolus. And so when you're looking at a disarticulated tibia, and is looking at a tibia that's not part of an existing leg, we know that this side is the medial side, which means that this here must be the medial condyle, right? Right, so that's lateral versus medial. In order to tell front versus back, right, working towards determining left versus right here, there is a bump on the front of the tibia only, right? So this is the anterior side of the tibia. This is the posterior side. Only on the front do we have this bump, right? This is called the tibial tuberosity. Okay, the tibial tuberosity, and this happens to be where all of your quadriceps muscles are going to insert. And they do that via the patellar ligament, right? So we talked about reflexes, and so when you hit that patellar ligament, it induces the reflex response of kicking out your foot. Okay, so that is the tibial tuberosity. So when you're looking at a bone, or at a tibia, look for the bump, the tibial tuberosity, look for what side the medial malleolus is on, and that will tell you which type of bone you have, the left or the right. Okay. All right, so that's the tibia. Remember that the fibula is the skinnier bone right next to it. All right, so fibula, right? The fibula is always lateral. Okay, the lateral bone, it's really just there for some extra support, extra stability. There are only two structures that you will need to know on the fibula, and that is the head, right? The epiphysis that is proximal, and all the way down to the other side. We also know this structure as well. This is your outer ankle bone, right? So when you run your finger down the lateral side of your leg, or the fibular side of your leg, you feel your ankle bone, and so this is the lateral malleolus. Okay, so that is over here as well. All right, and again, this is left shin. Okay. Once again, let's take a look at a tibia in real life. Okay. So here is a tibia. I won't tell you left or right, we're gonna figure it out. All right, so first and foremost, we have, this must be the proximal side, right, because it is the fatter end. All the way down here, we can see this little bump off to the side, right? So it's nice and smooth here. This is the weight-bearing portion. This right here, so you can see that is the medial malleolus, right? So we know what's proximal, we know what's distal, we know this is the medial side. Now, is this the front or is this the front? Okay, so now we can see that there is, or hopefully you can see, this right here is a little bump on the anterior side of the bone. This is the tibial tuberosity. And so if this is the front and proximal, this is medial. That means that this here must be a left bone. Okay, it is a left tibia, medial malleolus, therefore medial condyle and lateral condyle. And of course, this is the fibula here. I will not ask you left or right fibula. There are ways of telling, but without being able to actually feel it for yourself, I would not ask that of you. Okay. And just for comparison's sake, this here is a right tibia. Right? Again, tibial tuberosity on the front, medial malleolus on the medial side, so this must be right as well. Right. Back and forth today. All right, one more section here, and that is the foot. All right, so here are diagrams of the foot from 3 different perspectives. As always, the diagrams are right, the model is left, and that's how it would work in the lab as well. That's just always kind of how it goes, unfortunately. All right, so this image A here is looking at the foot from the superior side. Right, so this is the top of the foot or the metatarsal region. This is looking from the medial side, and the last diagram is looking at the lateral side. Okay, and the model is kind of angled so that you can see all of the bones in a really good way. Okay. The foot is broken down into 3 different types of bones. We'll start with the easy bones first. Okay. The toes, essentially, are the phalanges. The singular for a toe bone is phalanx. All right, this is singular. Okay, phalanges is plural. Please don't tell me phalange. That is not a thing. It is a phalanx. Okay. In general, your toes have 3 phalanges. You have the one that's farthest from the body, so this one is called a distal phalanx. You have the one that is closest to the body, so this one is a proximal. Oh, interesting. A proximal phalanx, and the one that's in the middle is called a middle. How convenient. Phalanx. Okay, and that is the case for the 4 main toes. It's different for the big toe, the hallux. Okay, the big toe, as well as your thumb, only has 2 phalanges instead of 3. So we only have a proximal and a distal. Okay, no middle in the hallux or pollex. Okay. The next group of bones of the foot conveniently are called metatarsals. Okay, so we learned about the metatarsal region, the superior side of your foot. These 5 bones are your metatarsal bones. And so to talk about each one of them individually, we use Roman numerals. The Roman numerals start at the big toe. So 1, 2, 3, 4, and 5 at the end. Okay, and just to be clear, 1, 2, 3, 4, and 5. These are your Roman numerals. Oops, please use Roman numerals and not numbers, right? Arabic numbers. Okay, okay, finally, we have the tarsals. All right, each one of these tarsals gets its own special name. okay? We'll start with the big one, okay? Because maybe we already know this one, the heel bone. Okay, so what is actually bearing the weight of your body when you are standing? This is called the calcaneus. Calcaneus is the heel bone. Okay, so again, that is bearing the weight of your body. All right, what is also bearing the weight of your body is the one that's sitting right on top of it. All right, so this right here. When you look at the top of the foot, it almost looks like this is two bones, but essentially this here is where the tibia articulates, right? Nice and smooth, curved in such a way that your foot can dorsiflex and plantar flex, also terms that you'll learn in today's lecture. But this bone, all right, as well as this one over here, this is where the tibia is going to articulate. This is called the talus. Okay. All right, next we have a little almost like a capsized boat shaped bone. Right, you kind of have to use your imagination for that, and there's a reason I call it a capsized boat. This bone is called your navicular, right? So navy, something to do with boats, right? Navicular bone. Okay, and I'm going to take this metaphor a little bit farther. If we look at the superior aspect of the foot, we'll see that sitting in that little green navicular bone are 1, 2, and 3 happy little bones kind of like riding in this little boat, right? Same thing over here, 1, 2, and 3. Okay, all of these bones are called, and I'm going to say this really weird so that you really think about the spelling, cuneiform, and I know that that's not how it's spelled or said in real life, but I really want you to spell this correctly. These are all cuneiform, so named after ancient text, right? So kind of blocky text. All right, so on the toe side, we have the medial cuneiform. On the lateral side, we have the lateral cuneiform. And in the middle, we have intermediate cuneiform. Right, so again, they are all kind of sitting happily in this little navicular bone. Okay, on the left foot, right, the model here, on the big toe side, that must be the medial side. So this is medial, intermediate, and lateral. Okay, and so that leaves us with one final bone to learn today. And that final bone is this bone right here. So pretty much at the base of the pinky toes metatarsals, right? So again, here, we can see it's articulating with metatarsal 4 and 5. This is roughly box-shaped or cube-shaped, and so we call this one the cuboid. Okay, and so just to walk you through this one more time, here we have the, two, so the distal and the proximal phalanx. We have, oh goodness, that is just not working out very well. Sorry guys, we have the proximal middle and, proximal, middle, and distal phalanx. We have metatarsal, metatarsal 1. Oh gosh, it's just not going to work out. All right, metatarsal 1 through 5, and then the tarsal bones. Okay, so one more time, let me show you the foot model. I'll do this. Okay, so here is a left foot, right? Note the calcaneus, right, is really big. The talus is going to sit right on top of the calcaneus, and it is kind of curved, right? So I always remember talus is kind of curved like a talon of a bird, right? And so this, again, is going to allow the articulation of the tibia, right? So it lets you pull your toes up, and down. So dorsiflex and plantar flex. Okay. All right, so that. Next we have the navicular, right, sitting right on top of the talus, and 1, 2, and 3 little bones, the 3 cuneiforms, right, emphasis on the spelling. This one here is therefore the cuboid. Okay, metatarsal 1, 2, 3, 4, and 5, because this here is the big toe. Proximal and distal phalanx. Proximal, middle, and distal phalanx for the rest of the 4 toes. Okay, and so does anyone need to see any of those models again before I flip back to the PowerPoint? All right. All right, so if you missed any of those things, I give you the diagrams already labeled for you. I just think that it really helps you to actually walk through, walk through the models and the diagrams and actually spell it out yourself. But here you go. Here are all the labeled diagrams for you, right? Also, as part of the next lesson, you will see the knee. And so keep in mind that there are lots of different ligaments that essentially stabilize this joint. The patellar ligament, of course, is what ultimately allows the quadriceps femoris muscles to articulate with the tibia and therefore extend the leg at the knee. Okay. See, here are those same exact diagrams of the foot, and all labeled for you. And finally, just a little bit about the ankle joint. Remember that the tibia articulates with the talus. The tibia is the weight-bearing bone of the body, but the fibula is there for some extra stability. There are all sorts of different ligaments and muscles that you can learn in the foot. We are not going there. If you go into PT or OT, maybe you will learn all of those. Okay. All right, and so that is all for today. I appreciate you coming out and joining me today. Are there any questions that I can help you with? I'm gonna pause this as well.